line. Okay, can I see? Can see?
Yeah, can see.
Okay, so we come back to this point. The endocrine system. So just now I already mentioned hormone system is part of the endocrine system only because the body contains so many these are endocrine which will release all kinds of hormones. Besides the major eight hormones, when we talk about the hormone system, the major eight very main endocrine that release the very important hormones in the body. So hormone, when we talk about endocrine, is a network of our glands inside the body, which will release all kinds of hormones. The objective of release all these hormones is actually to make a communication, okay, between the brain to the cells or the organs or the system in the body within themselves. They have to communicate, and then the hormones is acting like a messenger to transmit to beside the nervous system that we have. We're using the neuron to transmit all the information. We also use the hormone to transmit a certain type of very important information in the body. For example, like period cycle, okay, there will be communication between the pituitary gland with the ovary, okay, and then maybe the adrenaline, okay, will communicate with the heart or something like that. So we need all this hormone to become the bridge so as to communicate within cells and the organs and the system. So all the cells, organ, and function of your body have something to do with the hormone. So hormone is very, very important. Okay, to make sure the whole body can function properly, we have to make sure our glands and our hormones can be released in a very stable way. Okay, so earlier chapter I would already mention the basic glands are in the body, three the hypothalamus, and then the pituitary gland, the pineal gland are in the brain there. Okay, so these are the master hormones they're released to control other hormones too. So other hormones, there are thyroid or parathyroid glands, thymus, and then our this adrenal gland, our pancreas release insulin, and then the reproductive organs, the ovary, and then men we got the testis. Okay, so these are the major glands in the body. If they release in a manner which is not in a proper way, then we might have all kinds of problems that might happen to our bodies. Okay. Okay. I think I opened. What happened to this? I think I opened the wrong file only. Okay. Let me see. Very sorry. Seems like tonight I've got so many problems. Yeah. I think so. Yeah. Let me see in the back there. Whether is it correct or not? Yeah. This is not the correct file. Let me open another file. Okay. Very very sorry. PhD plus cell dot then the hormone illness number two. This should be the right. This should be the file. Sorry for the. Eh, open the right file. Where is the file? PhD. You can open. Plus minus two. Minus two. Sometimes too many file, I also get confused. Okay, let me see. Yeah, this is the correct file. Okay. One illness cause high blood pressure. Okay. Okay, yeah, this is the correct file. So today we are going to talk about high blood pressure and then this palpitation. Just now I've gone too far already. What is heart palpitation? Actually, the heart palpitation is a feeling that we are having, feeling like a very fast heartbeat, and then pounding heart when we have a stress exercise medication or very medical condition, it will trigger this kind of feeling that we have. Sometimes it's quite difficult to describe it unless you really experience it, then you know what is heart palpitation. Sometimes you don't feel comfortable because you will feel a little bit frightened, like the heart seems like beating very fast, but actually sometimes the heart is normal. Okay, it's not beating very hard, but you got that kind of feeling very strongly. Unless you have those irregular heartbeats problem, which are related or to other problems in the body. Okay, but when hormone disorder normally it will lead to this kind of feeling, the combination of your heart rhythm and then the mind, how the brain read this kind of feeling, the reaction that you have. Okay, so heart actually palpitation is quite worrisome, but usually is harmless. Okay, after you rest for a while, it will go off, and in rare cases, there can be a symptom of a more serious heart condition. Okay, like just now I mentioned. Okay, such like the irregular heartbeat. Okay, irregular the arrhythmia that might require treatment. Otherwise, uh, uh, those heart palpitation, you just calm down yourself, then it will goes away, or it won't harm you too much. Okay, but the kind of feeling, is not comfortable, and then you won't like it very much. Okay, just now I already mentioned those gland that affect the hormone secretion in the body, and then when we have the problem of high blood pressure and then the heart palpitation, normally it's because of the uh, imbalance hormone release of certain gland inside the body, especially what we call the adrenal gland is having problem, or sometimes our thyroid gland it got problem also. These two gland normally it will stimulate metabolic and then make you feel nervous, make you unstable, and then easier to get anger, and then you put into a condition, especially the adrenal gland, where you might experience the condition that you are get ready to fight for something, especially because the gland normally will release all kinds of stress hormone when we face in our normal daily life. We might face a lot of problem. We must face a dangerous condition or difficult times whereby we need uh, to actually strengthen ourselves to fight or to escape, to run away from certain dangerous situation, uh, which maybe will threatening our life. So we need the body to suddenly to give us strength, energy, so that we can either fight back or we run away. Okay, sometimes they call the flight and fight condition. So the body need to react on the condition, and then the body need to release some hormone, which will inform all the body to go to a stage whereby we will we raise our temperature, okay, increase our this energy production so that we have more power. We make our brain to be more alert, and then our sensor, those eyes, ears, become very, very alert, and then so that we can either fight or run away from a very pressure position or a very dangerous situation. So all this stress hormone uh, release majority from this adrenal gland, or sometimes the thyroid gland might affect the condition to speed up all the metabolic also. But the major thing, major hormones that are released by the body, so we can go into a state there whereby we can have a very strong energy, they're very alert, so that we can run or fight against certain dangerous situation. So these are the hormone, the adrenaline, uh, a very famous, normally we know one, we call it cortisol, okay, and then aldosterone. These are the three, okay, major, okay, hormone. Normally we consider them as the stress hormone inside the body. They are working, okay, oppositely, okay, like our happy hormones, those endorphin, okay, 这个this serotonin, okay, those are happy hormone which will stable, relax our mind, and then this stress hormone will make you tension, okay, and then you fight against all the stress, and then all dangerous situation. These are two different types of hormones in the body, okay, that will actually activating the brain to act differently and to release, okay, to change the level of the hormones inside the body differently. Okay, so earliest chapter we mentioned that if the happy hormones is releasing a lot in the brain, then you feel happy and then feel comfortable. So you won't you can sleep nicely. So you won't go easily go into those all these what we call emotional or unstable condition. However, if the stress hormone, okay, is released very high in the body, and your brain will be activated to go into a stage, okay, which they have to act okay, very fast and then very nervous, okay, and then in the long term, of course, they will create insomnia, or this depression, anxiety, manic. That means if you have this kind of what we call the emotional disorder problem, that means the stress hormone in your brain there will be higher than those happy hormones. Okay, so if we want to control on this, we have to take into consideration how these hormone they really release inside the body, and then how the body react when all this hormone is high, okay, in the body, and how the hypothalamus will react. Okay, so first of all, we're looking into this adrenal line, okay, released by the adrenal gland. Another name how we call this adrenal line, we call it catecholamine. Okay, catecholamine in the body. So it is a hormone associated by the adrenal medulla. When the human body experience certain situation, okay, stimulation such as excitement and fear, okay, this hormone will release, okay, and then it will increase the heartbeat, and the what we call the breathing will be faster. Okay, so your inhale, exhale will become very short. It will increase your blood flow and increase your blood sugar too, thereby increase the strength and speed of reaction. So this adrenaline can also be used, okay, to rescue patient from cardiac arrest and this uh, anaphylactic shock. That means the sometimes a sudden stop of the heart. Okay, normally the doctor will inject this hormone, adrenaline, so as to reactivate the function of the heart. Because normally when we are in fear or in tension, this adrenaline will speed up the heart beating. Okay, just now we mentioned about what we call the palpitation. Sometimes because of this adrenaline is going up, okay, and then it affect the heart to pump faster, and then the reaction on the vessel in our body will react differently. Sometimes it need to pump the heart, the blood more faster. Okay, so the reaction will be contraction on your all the blood vessel also. So when it becomes very high, okay, the contraction of the blood vessel become high also. And then sometimes this uh, uh, sometimes might not increase the what we call the blood flow, but actually it will lead to a higher heart pump, okay, which lead to hypertension. Okay, the blood pressure will goes up. Okay, so if all the times when we are facing pressure, when we are in danger, then and the adrenaline is releasing too high, then the reaction on the vessel will be contracting too much, and then this will cause the pressure, the blood pressure to goes up. This is one of the reason. Sometimes when you see doctor, when you check for the reason why you have a high blood pressure, those are I unidentified reason, okay, to cause a high blood pressure. Normally the doctor will say because of the irregular release or the imbalance release of your adrenaline. Okay, that is the hormone, what we call the catecholamine hormone is not balanced, is too much. That's why it causes the heart to beat faster, and then the blood vessel to contract more, and then it finally cause the goes up of the high blood pressure, and then palpitation might happen because the heart have to either press uh, by more hardly or increase the heartbeat. Uh, it will start to beat more times, especially for those people who are not that high in their blood volume, okay, who are facing a problem of blood volume one. Okay, they normally their heart is not that strong. They cannot increase the strength of the heart. In this kind of situation, the heart may require to beat more times, so as uh, enable to push, okay, the blood to all the cells inside the body. Okay, so this first reason why we have this normally hypertension, which very difficult to identify. Either is due to your lifestyle, okay, or your eating habit. Normally, sometimes when you cannot identify, then you will okay go back to these adrenal problems. Okay, the imbalance of the hormone that cause okay, the problem of the heartbeat become very fast. Okay, and then the other types of this hormone also released by the adrenal gland, we call the cortisol. Okay, and then the cortisol is really the stress hormone. When we talking about uh, controlling the pressure of the heart, and then the increase of glucose inside the heart, because it will acting as an agent to inform the brain and then the central nervous system to do the necessary reaction, and to inform the liver to release the glycogen that contain in the liver there, so that more glucose will be in the in the bloodstream. Okay, so it will eventually increase the heartbeat, increase the level of pressure inside the what we call the vessel. Okay, so normally it will release more in the early morning. Okay, and then it will slowly go down when the want to go to sleep. Okay, so that when it goes down, so the body other types of hormones will release. Okay, then we will go relax the body and then we can sleep nicely. Okay, so if let's say at night, okay, you used to do a lot of thinking or playing with your computer, and then you get excited. Okay, you are stressed or you have to work at night, then this cortisol may release more in the night, and then it will eventually make your blood pressure to go up, and then your glycogen to release, and then your body will be more busy in producing energy, so as to let you to handle, to face all the tension, all the problems, and then finally your brain have to work overtime, and then it will make you difficult to sleep also, or if your cortisol level is too high. Okay, so we can say on the other hand, if the cortisol is high, that means those happy hormones, like serotonin, okay, the dopamine, okay, all these maybe will be low in the brain there, okay, because they are controlling how to relax you. So your cortisol is too high, you might disturb the release of those happy hormones, and you will facing the problem of difficult to rest nicely, okay, to sleep properly, and then your high blood pressure will start to raise, okay, because of all this activity in the body. Okay, so this cortisol. So if you really want to handle to make yourself more relaxed, you must avoid okay, the release of cortisol in the more body in a very high volume. Okay, so the third one we call the aldosterone. Okay, so the aldosterone hormone mainly control your also you see the blood pressure also, because it control actually all those ionic minerals, okay, like your sodium, potassium, and then control your water content inside your body. Okay, so the aldosterone, okay, if too high or too low, it might okay affect your water retention in the body. Okay, because it will affect the ionized sodium, ionized potassium level inside the body, which will eventually affect the reabsorption of water, okay, in your colon, and then sometimes in your kidney there also. Okay, so if it didn't function nicely, it will affect your blood pressure too. Okay, so the adjusting of your blood pressure levels sometimes it have to be it part of it are affected by all these minerals in the body also. Okay, and especially like your nervous system, your neuron are seriously affected by all these minerals, and then the contraction and then relaxation of the blood vessel depends on very much on your minerals too. For example, if you are getting too nervous, you might have a doctor might maybe will advise you to take more like magnesium, calcium. All this will help to calm down, to stabilize your nervous system and your neuron to act in a better way. Okay, and then for those people, maybe sometimes the contraction of the blood vessel is too high because of this all this adrenaline, okay, aldosterone, okay, and then maybe sometimes a doctor might prescribe some medicine which will control uh, the absorption of all this calcium, the calcium blocker, okay, so that to reduce the contraction of your vessel, to make sure the body uh, won't react too actively sometimes. Okay, and then these are how all these hormone, okay, will affect our body. So if all these what we call the stress hormone is too high, of course, first thing you will experience difficult to sleep, okay, rest very difficult. Then all those emotional control, you might have some problem. You get easily get go into the state you feel you're feeling like fear, and don't get anger very easily, and then maybe sometimes long-term insomnia, it might lead to more serious this brain problem, okay, like this depression, anxiety, okay, all these problems might happen inside your body. Okay, so they are responsible, okay, to make your blood pressure to goes up to, then eventually it affect all the heart beating. Okay, sometimes the heart palpitation might uh, happen inside the heart, and then it makes you feel very uncomfortable, very uneasy. Okay, and then this is how it happens. So like high blood pressure, we got a very complete talk on high blood pressure earlier. Maybe you can refer to the topic, okay, what causes high blood pressure. But here we just like to let you know hormone imbalance is one of the reason, okay, blood pressure won't be stable, because okay, this will happen inside your vessel when all this stress hormone becomes very high, or because of your emotion, the body is the hypothalamus is instructing your either the pituitary gland to release more those hormone to instruct the activity of contraction, and then the release of all this adrenaline, and then maybe the thyroid gland will release certain thyroid which will speed up all the metabolic, okay, and then all these stress hormone it will eventually trigger the heart to beat faster, because it need to create more energy, and then it need to contract the blood vessel so that the blood flow can be speed up, okay, by the contraction. This what is happening in your body when this hormone get higher, okay, cortisol, adrenaline, and then the aldosterone, okay, in the body, it will react, okay, your blood vessel, so contraction will happen, okay. So but because of the normally how the contraction happen, and then more blood will have to flow out, so your heart start to beat faster, and then this will make your high blood pressure to goes up. But eventually, okay, the blood flow is not that good also, even though it's contracting, okay, because sometimes when the heart is the rhythm of the heart is not in a proper, and then the contraction is too fast, okay, sometimes it will affect the flow of the blood inside the blood vessel. So your artery, and then the supply of the oxygen and your nutrient may be affected. The distribution of your blood to the whole body will get into tension, and then this make the blood pressure goes up. But it doesn't mean it goes up, then the blood is going faster sometimes. Okay, and then especially like those what we call the microcirculation, okay, the microcirculation in the body, the contraction, sometimes the flow will be affected, and then eventually it cause some blockage might happen in the capillary. Okay, so in the long term, okay, when the body is acting like that, contraction is too high, okay, the heartbeat, the pressure is too high, then eventually make a lot of blockage in the capillary, start from the capillary. Okay, so supply of blood to all the cells will goes down. Okay, and then all this reaction, the release of the enzyme, and then certain the release of all this hormone in the bloodstream, it will affect the viscosity of the blood also, and then sometimes it might affect the performance of an enzyme, and then cause a certain this amino acid protein is not processed very well, and then the liver maybe cannot react too fast in processing certain increase, okay, sudden increase in the body, and then it cause the viscosity of the blood become higher and higher. Okay, so it become thicker and thicker, very difficult to deliver, and finally the blood flow will be slowed down, and then the delivery of oxygen and then the nutrient to all the cells will go down. Then of course this will cause the energy building inside the body will get lower. Okay, so this is the process once it's happening. So once the hormone imbalance is happening inside the body, okay, it causes the supply of all the blood to all the cells are getting lower down. Okay, and then not only the normal cells, especially like our neuron cells, the transmitting of the information inside the body will get unstable or cannot transmit properly. So the hormone imbalance release, okay, will lead to all these endocrine disorders, and then eventually we see like those stress hormone, once it's become imbalanced, it will affect those minerals reabsorption inside the body also, and then this is very interrupting, okay, the function of nervous system in the body too. So without the proper function of endocrine or the hormone, and then the nervous system or the neuron transmission, that means the communication in the body, okay, is become messy. Okay, they cannot transmit proper information from the brain to the cells to the organ, or they cannot transmit information within all the system like your circulation system. Okay, the brain cannot coordinate the heart and the vessel contraction or in a proper way, or maybe the function of your sometimes the muscle, okay, and then the release of all other kinds of hormones cannot be communicated in a proper and accurate, okay, manner. So this is begin all the system inside the body cannot perform their job properly, okay, and then cannot complete their operation without all the help of the communication. Okay, just like even you have all the airplane in a war, or you have all the airplane want to begin all the missile shooting, but without the GPS, okay, guiding signal guiding how to shoot, okay, eventually you will miss the target. So what is happened in the body if without the help of hormone and the neuron and the nervous system inside the body cannot communicate each other, and then the whole body will go into a very messy uh, imbalance of situation, and then the whole body system will get haywire, and then your inner doctor cannot perform all the function properly. This self-healing power will lost, and then you will have a very poor immune system. Immune system will go into disorder also, what we call the immune disorder. Okay, all the release of all the endocrine like your gas, all these stomach juice for your digestion, okay, will get into problem. All the endocrine system that release certain juice in the colon, okay, will get into problem. All whole body will get into problem because of the miscommunication in the body. Okay, So this is very important way. That's why we need to balance out especially in the brain there, the happy hormone and all these stress hormone in the brain. Even though, of course, we cannot go too extreme without having some level of all this stress hormone. We will go into a state of the body which are too relaxed, and then we finally the metabolic will go into a very slow position, and then we don't have energy. That is not the correct way also. But we have to restrain, limit, okay, control, okay, and balance, okay, the release of all this stress hormone in the body, okay, so that to make sure those relaxing hormone like your melatonin, okay, those are endorphin, dopamine, serotonin, okay, can will rebalance the whole body. Okay, so the whole body, when you reach the time you are supposed to rest, you can rest nicely. Okay, because melatonin will help. Okay, in increasing. Okay, and in affecting the whole body to relax. Okay, and then those endorphin will release to make you feel comfort. Okay, make you happy, and then you will go into sleep nicely. Okay, so all these hormone they might be affected by all these factors. Okay, environmental factor, or sometimes the change of climate. For those countries got 4 season one. Okay, so some people they might have a depression during winter time. Okay, or and then maybe some they might have different uh, problem like summertime, maybe the release of all these stress hormone become higher, then they feel difficult to control emotionally. Okay, thyroid maybe will release higher. These are caused by climate changes, temperature changes. Okay, in the body, how we call the environmental factor. Sometimes, uh, uh, like air pollution, it might brings all kinds of reaction in the body, and then it will cause the hormone release in the body to change also. Okay, number two, of course, the physiological factors. Either you are a man or a woman. Okay, woman will have period cycle, so different date, different times, their release of hormones will be different, and that is why sometimes ladies will easily get into a swing mood, or suddenly become very happy, suddenly become very angry, lost control. That's why because they have this period cycle where how the changes of hormone in the body have to be readjusted all the times, and sometimes they cannot cope with it or cannot adapt to it, and cause the release of hormone become imbalanced. And then furthermore, sometimes our lifestyle, like we don't want to sleep earlier. Okay, we always uh, become very active at night. Okay, don't want to sleep, and then take a lot of supper. All these physiological factors will affect the release of hormones in the body. That's why nowadays a lot of youngsters they experience disorder quite often. Okay, compared to those days, because of all this problem. Okay, and then even some they might have uh, okay, this development problem, like those kids. Okay, they develop too fast. Okay, they will have period of maybe at the age of 8 or 9. Okay, all because of all these environmental and the physiological factors. And then of course, okay, sometimes it's because of nutritional factors too. Okay, because the, the eating habit that we are practicing nowadays. Okay, and then the imbalance of diet that will cause the release, the forming of all these hormone in the body become imbalanced. For example, like thyroid. Okay, this ammonia, okay, iodine, iodine, okay, absorption maybe it's too high because of taking too much of seafood things, okay, maybe sometimes it's too low, okay, because of become a vegetarian and then without really taking proper foods, okay, sometimes iodine content maybe become too low, and then sometimes some people they might too restrict on the diet. uh, for example, they might control their salt intake, which will restrict some even restrict the consumption of iodine, and then finally it cause like hypothyroidism. Okay, some people, on the other hand, they might take too much of iodine because of uh, love for is a seafood lover, too much of prawn, okay, or just crab, okay, all these, uh, or vegetarian, maybe they take too much of seaweed, all those things, okay, which contain very high iodine, and then finally, okay, all this will cause these are hyperthyroidism. Okay, this is caused by nutritional factors, and then sometimes all the hormones they have a common uh, uh, things which are same, because the formation of the hormones, they need this essential fatty acid, essential amino acid in the body, mixing with some of the minerals, and then some of the vitamins, different types of vitamin to build, okay, different types of hormone in the body, but they are common. In common, they need this essential fatty acid and essential amino acid inside the body. So without providing all these essential fatty acid or amino acid, of course, the lack of all this material, the body cannot produce proper hormone inside the body. Okay, and then finally, of course, how you react, your attitude, your thinking, and then your emotional reaction in your body. Of course, sometimes emotional might caused by all the balance imbalance of hormone release in the body, but some people they might caused by other factors like attitude, thinking, and then how they behave, okay, in certain uh, uh, what we call your value on the evaluation of all the things that happen to you, and then the reaction that you have used to, okay, react on those things, and then this habit might cause emotional problem, and then this start to affect how your body to uh, rest properly, like how you start to have emotional problem, then you start to have insomnia, then for a long term of insomnia, then your release of hormone is imbalanced in the body, and then it again affect the brain release of all those happy hormone getting very low, and then all this stress hormone getting very high, then you get more disturbed in the this emotional uh, way, okay, and then finally you get crazy something, okay. So these are the four factors normally affect the release, and then we have to learn how to try to control the release of this. So today I will make a simple use of I'm laser, okay, on how to treat all this and regulate and balance the endocrine system by using I'm laser. So last topic I've already mentioned, okay, so the use of the light 650 nanometer uh, red light, okay, that created in this I'm laser, and then penetrate to our body through the laser technology, so that it will goes into the bodies, and then the content of the photon will react in our bloodstream. So the reaction of all the enzyme activity will be increased, so that the cleansing of the blood cells will happen, and then it will finally cleanse the blood. Okay, improve the blood viscosity and promote better blood circulation. Okay, this is the theory of eye laser by using the stimulation of the photon, to the increase of the activity of the enzyme. And then secondly, it will activate the enzyme activity inside the cells near the mitochondria there, to speed up all the activity of production of energy, the ATP production. And then the body will use the all the nutrients that we supply, and then oxygen, water, to generate all the energy that we require in the form of ATP. Okay, that's why after using the IM laser for a certain period of times, you might be able to generate more energy, with the help of the photon, by activating all the enzyme activity in the cells, and speed up the production of ATP in the mitochondria. Okay, so light therapy effectively promote self-energy. So we know that the whole body, all the organs are made up by cells. And then the creation and then the increase in energy of all the cells, increase in the metabolic and the strengthen of the cells function. Eventually, it will help all the organs, to strengthen up their function. So the organs will perform better. Either your heart, your liver, after a certain period of using IM laser, all the cells will be activated, and then the function of the organs will get better. So the filtering of your blood, the strength of your heart, and then the release of your insulin, where all this may be improved or restored to the original position, whereby all the time they cannot release in a proper manner because of the weak energy in the cells of all these glands and all these organs. Okay, so long-term improvement on our gland function may happen, especially if we are using it. We are talking about the endocrine system improvement. Okay, that's why sometimes we want to increase the performance of the glands. Maybe beside the normal usage on the wrist and on the nose, we will add on the use of the target treatment on the gland itself, like maybe for relaxation, to increase those happy hormones in the brain. We will encourage you to use the eye laser beside using on the wrist and on the nose. We ask you to put on the bai hui, on the top of the head, and then the forehead here, the yin tang, where there's a very small hole here. We can penetrate the light go into the brain, so that we can activate the pineal gland, pituitary gland, and then even to harmonize the balance, and then to calm down the activity of the hypothalamus, so that happy hormones will be released more in the brain there, to calm you down, to relax you, to make you feel more happy, and then it will uh, uh, affect the production of all the others hormones inside the body, like adrenal, your thyroid, your what we call the even sometimes your pancreas, your thymus, your Virginia, all these hormone will maybe will receive a better information, better signal from your pituitary gland, which inform them to release the correct amount of the accurate hormones to activate the body in a balanced way. If not, if the stress hormone is released too much in your brain there, of course your pituitary gland will be unstable also, because the instruction from your hypothalamus will be in a nervous state, which will inform the this pituitary gland to release more those stress, those direction to get more stress hormone to come out. Okay, because you are in the state of fear and dangerous. Okay, this is how it functions. So for those who experience hypo condition, okay, hyper condition, okay, normally we'll ask them to use the arm laser on the forehead, on the top of the brain there. Okay, let me show you I come back later this part. Okay, I show you this some of the thing we can yeah, where is it? Yeah, very sorry just now, because just now I start late because I'm busy creating the form. I think I didn't successfully download into it. But anyhow, maybe I will post some extra information to our red club there. You all take a look on that. Okay, because there are few things I want to mention here because I created a slide to actually to explain how in more details. Okay, so for those who have experienced all the glands where they go into hyper state, that means they release a lot of those hormone. Normally they release too high, okay, like the adrenal release too high of adrenaline, okay, this andros, uh, uh, aldosterone, okay, and then this cortisol, and then maybe your thyroid will go into hyperthyroidism. Okay, all this hyper situation, normally the use of eye laser will be concentrate on your forehead and then on your brain, and then you will do a target the normal standard treatment on your wrist and your nose. So the extra treatment will be on your forehead, on your top of the head, the pie shape there. Okay, these are the two parts whereby you start how to use, because and then when you use it, please combine with some stretching exercise, like before you sleep you can do some point toe, flex toes, all this. I will show you some picture afterward. I post it into the red club. I'm very sorry because I think I don't want to go and search again. Okay, so that to save sometimes. Okay, so I will have some diagram to help you, and then maybe you can use before you go and sleep. Okay, before you go to sleep. Okay, then you can on the bed there. Then you can do some stretching exercise to relax down. Okay, to relax your muscle first. Okay, so stretch a bit on your muscle, and then maybe you can do some meditation, 10 minutes meditation to controlling your breath, your breathing. Okay, maybe you can do 10 minutes of all this abdominal style of breathing. Okay, and then do your stretching on your muscle. Okay, for another 10 or 15 minutes. Then you feel tired, then only then how you lie down. Okay, then you start to meditate. Okay, then when you lie down, you start to meditate. Then you put on the arm laser on your forehead here, and then on the top, okay, of the by shade there. Okay, so to let the light to penetrate into the body in such a way when you are doing all the relaxation work. Okay, this actually we are based on Chinese Qi theory, whereby normally our meditation, our thinking uh, can actually affect the flow of the blood and then the Qi inside the body. So when we do a lot of all this meditation to make you relax, all this light, all the photon, maybe it will be leaded to all the neural function which can relax you down, and then or maybe more of the photon will go to the all the tendon. Okay, when you do the stretching, all those okay, so that the relaxation will be better. Okay, and then after a period of time, you'll find that you'll get into relax or easier, okay, and then faster, and then the calm down of your brain will be faster because sometimes the release and then the happy hormone in the body will get into a cycle or slowly build up when we relax down or we get instruction to breathe, deep breathe, and then the very fast the brain will uh, goes down, and then the brain activity will slow down, and then the whole body can be relaxed down in a very short period. Okay, this is what I normally advise. Okay, you all can do if you have your endocrine system in hyper stage, okay, in the release of too much one, okay. So you see like your this pineal gland, or if the pineal gland is released very high, then you get into sleep better, okay. And then the pineal gland it will affect the release of the happy hormone in the hypothalamus also, okay. So the happy hormone will release more also, and then it will eventually adjust back, okay, the instruction to your pituitary gland, which release the instruction give the hormones to instruct all the thyroid, and then all the adrenal, okay, or others these are testes, these are vaginal to react in a better way. Okay, so like those people who have period pain, there's problem within the communication of this brain and then the testes, or these are what we call those hormones in the sex endocrine, okay, the communication, okay, will be in a more harmony and balanced way if you can, okay, tuning the brain in such a way. Okay, however, for those their endocrine system is in hypo condition, that means the release is too low. So normally if let's say the thyroid is releasing too low, or the adrenal is releasing too little, then you might experience your activity become very slow, your metabolic become very slow, or you will react, or your brain function also become very slow, and then you get fat very fast. So on the other hand, if you're hyper one, you will get very slim because the metabolic become very fast. So hypo one, metabolic become very slow, you get easily or get very fat, and then your talking become very slow, or your the whole body water retention might happen during that time, or more severely. Okay, and then in this case, the use of iron laser may not be the same. Okay, then maybe you have to do target treatment on the gland. Okay, uh, uh, actually like your thyroid gland, you will go directly to your thyroid. Okay, you put on your thyroid. If you feel that your this immune system is very low, okay, you can put on the thymus. Okay, and then if you all the time you have all the cannot perform your period cycle is not that good, you want to activate you want to make it to react in a more better way, because then you can put on your abdominal there. Okay, and then maybe sometimes you might feel that adrenal, you want to improve it. Okay, you want to improve the function of your kidney also, you can put at the back the Mingmen there. Okay, so to activate all these gland, okay, so directly they will receive, okay, the light, the photon, so that hopefully, okay, by receiving all the photon, the activation of all the cells, okay, in all these gland there, okay, will be higher, and they activate the function of all these gland, and then it will trigger more, okay, a release of the hormones in all these glands. Of course, we have a cell balance okay, of hormones in the body. Okay, but if you directly target the gland, normally you will trigger the release to be more high of certain hormone of the gland itself. Okay, and not even though we can, the body will readjust. Okay, but we feel that directly to the gland, you will actually activating to release more. Okay, those hormone in the gland. Okay, until the function of the gland is in a more stable, okay, way, then maybe the self control, because the gland is affected by other release of hormone from the top, okay, your pituitary gland and your pineal gland. That's why normally when you put the activation of photon onto the gland, like your thyroid, it will activating. So for those who are having hyperthyroidism, you are not advised to put, okay, the device directly onto your thyroid gland there. Okay, not advised. Okay, so you have to learn sometimes, or you have to consult with your doctor to really understand if you have thyroid problem, whether you are hyper or hypo. For those who are selling, okay, the eye laser, you need to study, okay, those symptoms which are related to hypo, or the other way around are related to hyper. So you must have basic knowledge on that, so that you will give a better advice to how to use the eye laser. Okay, unless if you really not sure, then you use on the wrist and then on the nose only. Then you don't directly put on the gland to activate anything lah. Okay, but I will hope, okay, you can learn some of all these meridian point, okay, and then some of the activation of target treatment, because beside all the joint pain, you can use the theory of meridian system, okay, to treat a lot of others illness also. Then we can strengthen and then make use a maximum optimum use of this eye laser. Okay, so these are the basic that we can do some things on eye laser. Okay, when you use it. Okay, so eye laser, just now I already mentioned. Okay, the basic theory is using the light. Okay, number one, to cleanse your blood. Number two, okay, to increase the generation of power, okay, of energy in the cells, so that how the cells can be restored, can be repaired, or can be regenerated, or because the light can activate the function of all the system, and then maybe how will stabilize the release of all the growth hormone, and then induce, okay, the release of all the growth factor in your liver in a proper way, and then it can induce the working of all the stem cells, okay, together with all the growth factor to work together, so that to regenerate all the new cells in the body. So this is the fantastic way, okay, of using eye laser to create to repair, to create a new cells, to repair those uh, damaged or die cells, so that your organs can be maintained in a very proper way. So the function of the organs can be carried out in a very optimum, okay, condition. The whole system inside the body can act nicely, okay, because of the communication of your neural system, okay, especially your neuron can be repaired and can be restored, can be regenerated, okay, by using eye laser to repair all the neuron cells. Okay, so this transmission of information in the nervous system can be improved. Okay, and then, okay, the improve of the all the hormone secretion in the body is a channel of communication among all the system also. So you have a very stable system in the body coordinating each other. That means your inner doctor become very strong. Because when you talk about inner doctor, you are talking the coordination within the body, all the system, how they work in a very powerful and balanced way, then your inner doctor will become very strong. So your healing power in your body will become very strong, and then you can sleep nicely at night, and then during night you can repair your body nicely, and then of course, okay, it will delay all the aging process. You'll have a better cells, okay, better replenishment of new all these nutrient to all the cells, and generating of the energy inside the cells will be increased, okay, to a optimum level. Okay, so beside that, okay, actually the healing ministry of Ventros recommend the combination of the use of iron laser and CVA tool. Okay, because CVA so far, if you want to know the full detail of CVA, refer to the video that I've created. What is CVA? Okay, you will know better, and then all the details inside. So far, let you know CVA, okay, is providing the full range of nutrient that the body needs. When we use the light to activate the creation of the energy, we need all kinds of nutrient, okay, to be supplied to the body. So CVA will be a very good choice because CVA contains all the nutrients that we need, okay, all the essential amino acid, essential fatty acid, all kinds of minerals, all kinds of vitamin that we need, okay, in the body, okay, they are inside the CVA. Beside that, we have ginseng oxide, okay, and then a lot of antioxidant property, because CVA is made from this wild ginseng using a very high technology. 86 country registered patent on the use, and then the only one, and then so far the first one in the world, okay, which created by this Plantel Korea, okay, in Korea, they combine with Ventros, they form a research center and then formulated the CB8, this product. So the wild ginseng stem cell, all this property, okay, ginseng oxide inside there is very high in content and very consistent. The process of uh, extracting or what we call uh, because they use a technique, okay, to make use of the stem cell of wild ginseng and then to develop further, okay, so that it will create all kinds of chemical, all these phytochemical in the wild ginseng, what we call the all those ginseng oxide, the rare ginseng oxide, which only those are rare all this wild ginseng will produce, especially those very old wild ginseng only uh, uh, capable of producing this kind of ginseng oxide. So they are using a very high tech technology to create it, okay, and then it will bring a lot of benefit to the body because all this ginseng oxide they claim, okay, to have very good effect on activating our stem cells in the body, in our body too, okay, and then in inflammation, antioxidant, and then anti-cancer, okay, improve coordination among various body system, okay, through strengthening the neuron function by the all this ginseng oxide. Okay, so CVA is a perfect combination of iron laser, okay, to produce a very very good effect in improving the performance of our cells, and then to as well to promote very high good quality of sleep, okay, the release of your melatonin will be in a very balanced, very stable way, and then scientists also sense that discover that our sixth sense also depends on the function of pineal gland, okay. So that's why sometimes your dream might come true because what you dream is a sense also. Okay, sometimes your sixth sense is very strong. Okay, what will happen in your future, you will you'll get in your dream first. Okay, that is the working of your pineal gland, of the function of it. Okay, and then pineal gland will help a lot in relaxing yourself. And then maybe you can try beside CBA, you can add some more in your daily 3 meals. Okay, more eggs. Okay, your banana, and then those seaweed. Okay, spirulina. Okay, some of the milk. Okay, because all this it will increase the level of serotonin in the body. Okay, and then all these food are contain very high tryptophan. This type of essential amino acid which contain in our ginseng CBA2 is quite high level also. Okay, that's why if you are concerned consuming CBA, okay, then maybe how you can take less of this. But of course, I will advise you because all this daily food you can take from the 3 meal. Okay, so that you won't rely only on CBA or to get all this tryptophan. Okay, and then the serotonin making, because tryptophan and serotonin can be converted into melatonin, which will uh, make you relax and help to release all the happy hormone. Of course, serotonin itself is a happy hormone already. Okay, so it provides complete nutrients, especially tryptophan and serotonin can effectively promote the quality of sleep. Okay, so the superoxidant in the CBA, because CBA beside the ginseng also contain what? Cipaton, aronia, berry, and then this pomegranate, promo, pro, how to say already, pomegranate. Okay, fruits which are very high in all kinds of minerals and vitamins and super antioxidant, because it contains all kinds of high these what we call the phytochemical, and then all the OPC. Okay, it's very very high. Okay, and then the use of this Cipaton is really a very good combination with the wild ginseng, because first of all it contains all kinds of essential fatty acid that the body needs, and then sometimes some of the nutrient, some of the vitamin that are contained in the wild ginseng or in the this aronia berry, and then the pomegranate fruits. Okay, those vitamins are oil-based. They have to combine with certain fatty acid. Only then they can be absorbed by the body. And then some of the ingredient in the wild ginseng also the same. So it really the combination really provide very high antioxidant to protect all those ginseng not side from all the oxidation of all kinds of free radical inside the body. Okay, so ginseng oxide can effectively promote the stability of the nervous system and balance the secretion of hormones. Okay, so high content of minerals can effectively stabilize the nervous system too. So this is in view of improving all the endocrine system inside the body that we need. So it all contained inside it. So this so eventually it will help the body to provide endorphin, dopamine, serotonin, oxytocin. So in order to let you, okay, to be more stable in the release of your all the hormone, because mostly a lot of people they experience problem of hyper more than hypo. Okay, like hyperthyroidism, hyper adrenaline. Okay, so to relax them down, we need all these happy hormone. Okay, so in daily life, maybe we can practice exercise more to create endorphin. Okay, to achieve very small achievements, set small goal, and then hit it every day. Or then you will experience dopamine release in your brain. Okay, and then with a gratitude style, and then to be useful to others, to help others to grow to success, and then you feel happy, then we create a serotonin in the brain there to encourage okay, to help your children, your friends and family get back into track by hugging them, okay, give them a big hug so that the body can release oxytocin inside the body to calm down them, to let them feel more stable, more comfortable. These are the way we release all these happy hormones inside the body. Okay, so for those who are experience hypo, okay, the gland cannot perform properly, cannot release properly, then we are advised you to do more aggressive exercise like cardio exercise to make sure you will be in a state to be more active. Then it will okay uh, uh, lead the body to go into a stage which you need more energy. Then the release of those adrenaline, all those hormones will be higher, and then the activation of your uh, uh, thyroid will be increased. Of course, we will ask you to do all this exercise by wearing your this arm laser on the wrist also, okay, while you doing all this exercise, okay, because now your nervous system, okay, normally we have two types of nervous system. One is to make you aggressive, or one is to make you relax. One those aggressive one you are not so good, okay, they are not communicate and then doing so well. Now we want to activate those groups of neuron so that the transmission or maybe will be better, okay, to make you more excited, uh, to make you to get more energy. Then you do direct target treatment, or you need to do aggressive like cardio exercise when you use arm laser. So it would promote the whole system to go into a more aggressive way. Then your release of hormone will be upgraded. Okay, then they will release more. Then you won't suffer from those hypo problem. Okay, but anyhow, on your forehead, on your top of your 百会穴, on top of the brain, no matter whether it is hypo or hyper, you can do that also. Okay, there is trying to do a balance, because in the brain there, okay, we have the mechanism to balance up actually the release of hormone one. And then sometimes the malfunction of the brain, okay, of the energy is not enough in the brain there, it causes the brain, okay, and then the hypothalamus cannot give a correct, okay, instruction, and that lead to the information received by pituitary gland or adrenal gland, or is not stable, and then affect the release of all the hormones below, okay, like your thyroid and so on. Okay, so with the use of arm laser and then your CVA, and then of course if you want to further strengthen, okay, the effect on your skin, all those, you want to regain your beauty on the appearance, then you can add on our serum, the CMC serum, also made from the wild ginseng stem cells, this phytochemical, or the ginseng oxide, or added with ingredients necessary for the build up of the muscle or the skin, or brightening skin, okay, and then remove all the spots, okay, all the pigmentation, and then within a very short period, okay, we can put all these nutrients through your skin, okay, in that means through your face lah, so you can improve the outer skin repair, okay, send all the restoration of the muscle on the face there, then your fine line, all the pigmentation can be metabolite, okay, can be removed for more easier by the use of CMC. And in your inner side, what will happen? Your blood circulation will be improved, okay, by the use of CVA and then arm laser too, because arm laser during the process of using, it will create another ingredient we call the what we call the nitric oxide, okay, which is very, very high uh, in her doing her all the cleansing of the blood, and then helping her to cleanse all the vessel, okay, so that the vessel will become very clean, okay, after a period of times of using, and very strong antioxidant. So it can eventually promote very, very good blood circulation. If you go through our blood test, you will see how the use of iron laser within half an hour before and half and after the blood flow, okay, and carrying of oxygen, and then the activation and then the activity in the brain that will be improved within half an hour because of the light going in and activated all the enzyme activity inside the brain there and cleanse all the blood cells. Okay, so it improve our brain function. If we go, if we want to activate those hypo problems, you can do direct on the gland there, okay, like your thyroid, your thymus, okay, your adrenal, okay, you can do maybe one day, 1 or 2 course of treatment, standard 4 bar, okay, maybe 30 minutes, okay, you can do that. If you feel that, okay, you are very low, okay, in the release of those hormones like adrenal, maybe how you might have feel that your what we call the desire for sex is very low. Then what we call all the sex performance is not that good. Okay, then maybe in terms of energy, you feel very low in energy. Then you can activating it by activating all this gland or by using target treatment. Okay, and then of course normally we use target treatment for iron laser to fight against inflammation and all the pain also, so all those joint pain, okay, any inflammation in the body, okay, because of heaty or because of any injury you can use, or some of the skin problem, okay, you might be able to use iron laser to help also, or in the healing of all the wounds, okay, it will be very good. Then it promotes the stability of the nervous system. Just now I already mentioned, because all the mineral supply, and then the stronger from cells function, helping by this iron laser, okay, make the communication, the transmission of the neuron become better, and then it will stabilize the working of your nervous system. And then complete nutrients promote quality sleep, restore, repair, reactivate, and regenerate all the new cells in the body. So eventually, from outside, with the combination of CMC serum, okay, you find all the black spot, this pigmentation, fine line, okay, all the problem of the muscle on the face, the lift up of the muscle, and then the skin texture, the brightness, okay, and then the blood flow to the face will getting better. Then you look younger, more beautiful, look red and then full of water, okay. What we call maybe you regain the look by 5 years, 10 years, by just having to use the combination of these three, okay, for maybe 3 months, 6 months, then you get this kind of result. And then for a long term of use, maybe you will totally slow down the process of aging, or maybe after 2, 3 years of use, or you will find, okay, you regain your youthfulness maybe by 15 years, 20 years, okay. It depends on individual use and then their body's reaction. And then, of course, direct reaction, direct feeling, you enhance energy, and then your this vitality, and then maybe you have a better quality sleep, and then high antioxidant. It is really very strong anti-cancer property, okay, inside CP8, okay, for those who really have after operation, after the treatment of cancer, or they can totally use the combination of these three, okay, I'm laser in the recovery of their injury of all this chemotherapy, radiotherapy, or you want to recover back, okay, you can use I'm laser to help. And then with addition, the CVA, okay, to provide you a very strong antioxidant. And then of course, for those who want to prevent cancer, okay, the use of this I'm laser and CVA, of course, they give you a very strong support because very strong antioxidant, and then the content of those ginseng oxide are well researched and confirmed. They are fighting against all these cancer cells, and then it have the power to depress the growth of all these cancer cells by the process of cutting the supply of blood, okay, to the cancer cells, so the nutrient and the oxygen, all those will not be delivered to the cancer cells, and the cancer cell will, because of starving, it will die off. Okay, so this is the function of CVA, okay, in the fighting, because the ginseng oxide have a very strong power to fight against all this cancer. Okay, so for today, after I've explained, you will understand why all those hypertension and then palpitation is not a big deal. Okay, if you are using I'm laser, okay, because uh, uh, the combination of I'm laser and the CVA are highly, okay, used in the improvement of all these circulatory system, cardio problem, all those heart problem. Okay, they will definitely benefit a lot of I'm laser. What happened? I'm laser and CVA. Okay. So far I share up to here, and I leave some time for you all to give some question. Okay, maybe I can help her to answer if you have any problem on any question.